but it like is after the fact. It's like not, so I don't know if I go to another screen. I'm not sure what to do here.
Well, it shows that we're live streaming,
It's
so
like
you
it's
want to
after the
just
fact.
start.
Not, oh, it started already. So I don't know if I go to another screen. I'm not sure what to do here. Oh no.
Well, it shows that we're live streaming,
Okay.
so
It's
you want to
after the
just
fact.
start.
Not, oh, it started already. So I don't know if I go to another screen. I'm not sure what to
Oh
do.
my gosh. It shows that
Okay, let's
we're
do this.
live streaming,
Okay.
so you want to just
I'm
start.
gonna do this. I'm
Oh,
gonna
it's start.
take it off there and go back to Zoom. Let's try this. Okay. I'm not sure if it's working. Yeah, it is working. It's on YouTube. Okay. Okay, everybody. Hello. We're testing this. We're just wanted a live stream because we are just beyond excited. For those who don't know us, I'm Margie Bissinger. I'm a physical therapist, integrative health coach, and specializing in bone health and osteoporosis. And with me,
And I'm Dr. Kim Millman. I'm an integrated physician. I have a private practice in San Jose, California, and I am an expert in integrative bone health care.
yeah, between the two of us, we have, I think, 46 years working with people with osteoporosis and bone health. So we're both boneheads and we're both very, very passionate about working with people with osteoporosis and bone health. And the two of us came together years ago because we were both on the same mission. And what we saw and what we still see is just so incredible, incredibly upsetting that well-intentioned people want to figure out what to do with their bones, and they're just not given enough information. Root causes aren't looked at. What have you seen, Dr. Millman? I mean, this is something that's just so upsetting.
I would say primarily that I'm seeing that a physician will talk to their patient and offer them medication and tell them to do calcium and vitamin D and not much else. Absolutely no investigation into root causes. And I think that there's a lot of fear that sets in and overwhelm. And my patients are just devastated by the diagnosis. They're thinking about, their mom or their grandmom, who had a frailty fracture and then they had a really debilitating rest of their lives. And they think that that's what's in store for them. And they don't have any options that are given to them. They don't even, some don't even realize, that there is another way to attack this. And I think that one of the things that I have been so hopeful for was your four summits and being able to be on the summits and giving women a another approach and all the education that you did.
Oh, well, thanks. And then so years ago, so Dr. Millman's one of the few people in this entire country, who's really working with osteoporosis in an integrated way and getting incredible results. That's what's so exciting. And that's what I think we're so passionate about sharing, that there is a way that we turn this fear into empowerment. Because when you take this approach, it works. It really works. It's not that we're against medication, because we're not. There's certainly a place for that, but there's so much else, even if a person is taking medication. And it's just giving people the knowledge and the tools. So after the summit, I had said to Dr. Millman, because people ask, well, where can I work? Oh, they love the information you presented on the summit. And where can I find integrative doctors who will work like that with me? And there was one you in California, and you could only see those patients. So I said, if you would start a class, a program, I really believe if you could do this in a group program, I really felt that you could help so many people. So that was years ago. And how many people have now gone through your program?
Yeah, I mean, it's really been wildly successful. We've had over 600 people now in 2.5 years go through the program. Incredible testimonials. People are seeing that their bone turnover markers are reduced by half. They're working with their doctors and they're encouraged and they're empowered and they really feel like that they can see another way, another path forward. And so it's been incredibly gratifying. But what has happened is that there's been so much demand that what we're finding is that although people are doing very well in the program, there are some people who really need that extra hand holding and some extra advice and some supervision through the process. And it was difficult for us because we had no one to refer these people to. And I felt, really that these people were being left behind. And so we started to talk about what could we do. And so then I asked Margie if she would be interested in starting a practitioner program for other practitioners to learn about this integrative way that's been so successful, and absolutely how gratifying it is to work with this population.
Yes, so that's what we did. There was absolute when you approached me, I'm like, I am in because this is what's needed. And the same thing with me. I get probably every day someone asks me, can you work with me? And I just am doing too much group programs and online, I'm just doing too many things. I don't have time. I no longer am able to see people one-on-one, but yet I want to refer out. I want to have people that I know are trained in this integrative method who can carry on this work. So when Dr. Millman asked me, I'm like, I am in, no problem. So we worked really, really hard creating this program. And it's just, I think one of the best things is that people don't have to reinvent the wheel. There's so much done for you material that they can use with their clients and patients. And we've been working, you've done this. It's taken you so many years to figure out what works. And together we've put this together, what really worked. Anyway, so we're starting our first cohort. We're only accepting 30 people, and we have a lot of the spots already taken. But we wanted to tell people because if you are a practitioner and there's something that you're interested in, we would love you to join us on this mission. And you can reach out to us and we'll give you more information. But we just wanted to let people know. What else do you want to tell them? I mean, there's so much to tell.
Well, we have almost 20 spots filled, so there are only 20 spots left, and
10 spots left.
literally we are starting in a week. So we want to give you a URL so that there's a place that you can go to learn more, and that is at thebonehealthacademy.com / and the next couple of letters are all capitalized. So IBHP and then certification, and certification will be lowercase. We'll have this link underneath this page so that you can automatically go to it. And you can learn more about it. But let me give you a little bit of a rough idea of what we put together. So we have the curriculum, which are pre-recorded science lessons, and they are going to be weekly for the duration of the program. We also have something that is a 10-week done for you turnkey program with everything that you need to confidently work with your clients in integrated bone health. We have a we have the practice management tools on the practitioner side, and then we have the client handouts and all the education materials that literally has taken a couple of years to produce. And then we have a business building aspect to it. It's called Practice in a Box. And we go through how to craft your messaging so you can attract the clients that will become your fans, your raving fans, and how to get these clients. And we also are going to have a referral directory, which is probably one of the most important things on our website that will help you to get clients. And of course, as we get to know you and we know that you understand how to do this method, then we will potentially, you have the opportunity for this to happen. We may personally refer people to you. And Margie, you want to talk to them a little bit about the certification requirements?
Yes. So basically, we're interested in people who are already practitioners so that you have the basic science, you have the basic knowledge, because you're going to learn about the labs. You're going to learn so much, but you need this foundation. and someone who really wants to work with this population as well as as has a background in this. So people, there's nurse practitioners, physicians, chiropractors, in terms of nutritionists. So people that have, and it's really good, especially if you do have a background in functional medicine, because this is an integrative approach. But regardless, just reach out to us. And if you have questions, send an email to which will be under this video as well as to support at thebonehealthacademy.com. And we can answer your questions, but there's only 30 spots. So you had mentioned there were
There's
20,
only 10 left.
only 10 left, right? So
There's
if
only 10 left.
I think you know, it's interesting because this is the first cohort, we are going to absolutely really get to know everybody, but make sure we want everybody to be really successful. And I know a lot of the people, care about not having the business background, but we're going to make sure that you have the skills, you have the tools. We'll have guest experts help with the marketing. So it's not something to worry about because this is so important. There are so many people that need this. And I'm just so excited because both of us have been so gratified. People, when you can help someone figure out why they're losing bone. And what happens, what I see is that it's a blessing in disguise. They stop at the end of the day, they look back and they say, because of my bones, nothing had happened. They just got this test. They end up doing all these amazing things. And what's good for your bones is good for your overall health. So they do exercise, they become really strong. And there's nothing more empowering than being strong. They reduce their stress, so they're happier. And they also figure out some root causes. So their digestion gets better, right, Dr. Millman? You see this.
Absolutely. Yeah, their digestion, they work on their hormones. We look at inflammation, toxicity, we look at heart health, and so many people have had they sleep better, they have better energy. And so the clients are so incredibly grateful for everything that we do for them, and they become raving fans. And my practice in Silicon Valley is already completely filled up, and we are looking at our new patients are coming in 6 months. So and I basically would love to refer to anybody that we get certified. So this is a serious certification program. We are requiring that we are having multiple choice quizzes at the end of each of the science lessons, and we're going to have a final exam. But we want to get behind you, and we want you to be successful. And we are completely 1,000% invested in you, and also having a great reputation for the program and for all of our providers, and then just spreading the word that we are the place to come for the gold standard in integrative bone health care.
And the truth is, this will spread. And so that, because we want everybody to be active and feel good, and there's no reason they can't. So that's what we've seen, and we know it can work, and we're just excited to spread it. So anyway, so it's starting next Monday. So if you're interested, as we said, there's 10 spots left. And we're very strict about this because we want to keep it small because it's also a great community. I can't get over, I have to say, the 20 people that we've accepted so far are each one just has, everybody brings their own special sauce to it. So I know the two of us are going to learn so much from the people who have already joined. And how beautiful to have this community of practitioners working together for such an important cause. So anyway, can't wait to see you. And if you're interested, just reach out and we'll get back to you. And we would just love for you to join us.
And if you're really on the fence about the certification program, and you're seriously interested, we are offering some individual consultations, 15 minutes for us to sit down and talk with you about the program and your goals and our goals for you, and to see whether you'd be a good fit.
Yeah, and if you're interested in that, just write support at thebonehealthacademy.com and we can set up that appointment. No problem. Okay, so we hope whoever's interested in listening will join us.